I think kinesiology is a great major for our pre-health professionals for a number of reasons. One of those is our courses are heavily case study driven. We're describing to you a patient, you're doing health histories as part of those, you're asking questions, you're explaining then to the patient how they can help prevent chronic disease, what risk factors they have and how they can manage those. Or if they have chronic disease, how can physical activity, and if you're a nutrition major as well, how might nutrition decrease your risk or help you manage your chronic disease? And the research we do, I think, is very applicable to those health professions as well. For our research volunteers, when we bring them in, what does it typically involve? It involves health screenings, it involves assessments, so we do blood lipids, cholesterol, we do HbA1c measurements, I measure markers of inflammation, so students get to see me place IV lines. They get to help draw blood from those IV lines. They get to process those samples, take them into the lab, and do the analyses. All incredibly related to what they're going to do as health professions. And then often our interventions are physical activity related. And as our students progress, you start to see kind of the light bulb go off. It's like, oh, it's not just sports performance, it's the impact that physical activity has on health. And when they move away from physical activity as a thing that I do for sports to something that's an actual prescription, and then understanding the magnitude of beneficial impact that physical activity has in reducing chronic disease or managing chronic disease. By the time they're juniors and seniors, you can see our students are really getting it.